Kentucky's special session on COVID response is over after just 3 days. Today, Governor Andy Beshears hit lawmakers hard for removing the statewide mask mandate for students, but complimented the two branches for agreeing on other matters.
The masking decision is a big decision. It was the wrong decision on hospitals, on long-term care. I thought they worked very well with the administration.
WHAS 11's political reporter Rachel Droz there for all of the action this week. Rachel, give us a recap on the 4 new COVID-related laws now in place.
Kristen, it was a late night in Frankfort, as many of you were probably fast asleep when lawmakers finished up their work and gavelled out just minutes before midnight. One big bill passing, an education bill. It gets rid of the statewide mask mandate in public schools. Local districts are now the ones deciding their own mask policies. It also adds 20 remote learning days. This is in addition to the 10 non-traditional instruction days they already have. One key difference between the two, remote learning days can only be used by groups of kids within a district. If an entire district is learning from home, it's considered an NTI day. The bill also requires public health to come up with a test to stay policy for school districts. This is aimed at reducing quarantines. Another big law that passed bans general statewide mask mandates until June of 2023. It also prohibits visitor bans at nursing homes, but that comes with guidelines, one of which restricts visitors to a single room. The new law also increases testing and vaccine access, and it lays out a plan to make sure all Kentuckians have access to monoclonal antibody treatments. Both of those laws partially vetoed by the governor, but lawmakers overrode those quickly. There were 2 pandemic-related measures signed by the governor. One resolution extends several pandemic-related emergency orders, such as banning price gouging and waiving licensure requirements. Another measure signed by the governor, a bill allocating federal pandemic relief funding for COVID testing. Last night, the House Speaker told me he talked to the governor and hinted lawmakers could be back to provide relief to rural hospitals.
I think it's important that we continue that conversation because the stress that is being put on rural hospitals is very real. And it's important that we continue to try to figure out ways to help them.
Now, one thing that didn't make it through, a resolution introduced just yesterday that would consider people fully vaccinated if they've had a positive COVID antibody test. That resolution passed out of the Senate, but the House Speaker tells me he decided not to run it to the floor because it was dropped so last minute.